Hello, everyone. Welcome, welcome, welcome. Tonight, our special guest is Leilah Sampson, author, kidney transplant patient, lecturer, businesswoman, all around great kidney advocate, and a very good friend. So please give her a warm welcome. In 2008, while attending Tuskegee University, formerly known as the Tuskegee Institute, you know which one I'm talking about, right? She learned that her lab tests were not good. The doctor was recommending a kidney biopsy to make a more precise diagnosis. She then called her father, a nursing director, who insisted she return home to seek care. There was swelling in her face and her legs and her feet. She subsequently saw a nephrologist at Northwestern Memorial Hospital. And after a kidney biopsy, Leilah was diagnosed with FSGS, focal segmental glomerulosis. I think that's how you pronounce it. She was told the disease has no cure, that her kidneys would eventually fail. She would need to go on dialysis and hopefully receive a transplant. She was also advised that FSGS could come back and attack her new kidney and possibly cause rejection. She was immediately started on immunosuppressive medications. Within the next 2 years, her kidneys failed, and she began a 7-year odyssey of multiple weekly kidney diagnosis appointments, deteriorating health, and several surgeries. Finally, in 2015, she got the call, and on December 15th, 2015, received the gift of life. With this new beginning, she made up her mind to become an advocate for patients with kidney disease. She then wrote and published a book, The Gift of Disappointment, and went on a speaking tour to promote it with her message of help. And here is one of my copies. My other copy is beat up, and I'm ashamed to put it on the air. So I bought this one brand new. So there's Leilah's book. Um, Leilah is a kidney advocate and currently runs LS Empowerment LLC. Please give a warm welcome to our friend, Leilah Sampson. How are you, Leilah?
I'm doing well, Jim. So great to see you.
Great to see you. Our friend Elizabeth Odom says hi.
Hi, Elizabeth. Hello,
Okay,
hello.
so did I state everything correctly in the
You
introduction?
did. That was an amazing introduction, Jim.
Okay. Please tell us a little bit about where you grew up, your education and employment experiences.
Yeah. So I grew up in the south suburbs of Chicago, Illinois, around Homewood, Flossmoor area. That's the high school that I graduated from. Um, I worked a myriad of jobs while I was on dialysis. Worked at a country club in the northwest suburbs of Chicago. I've worked for the Gift of Hope, organ and donation services. What else? And now I've decided to go back to school to pursue my degree. Initially, I was pre med, and now I am in psychology and looking to complete my doctorate in psychology. So I took a little break from the advocacy space, but I miss all of the kidney patients, all of the kidney friends. It's nothing like having, a group, a community of individuals who get you. Hmm.
All right. I understand that back in 2008, that's when your kidney experiences began. You were in your sophomore year of college, 19 years old, at
Yeah.
the Tuskegee University in Alabama. Can you please tell us what
Okay.
happened?
Oh yeah. I don't know. I just woke up with swelling in my face and in my feet, and I had a 24-hour urine collection done there, and I was beginning my sophomore year of college. The nephrologist, the local nephrologist at the local dialysis clinic gave me a call, said you need to come in right away. And, I was thinking, well, I just started classes. Can this wait? He said, no, you need to come now. So I went in to what I realize now was a dialysis center. And that's when he informed me that I could potentially have a kidney disease. So my parents put me on the first plane back home to Chicago. Began care with a nephrologist at Northwestern named Dr. Torzan. And there I was diagnosed with FSGS. And within 2.5 years, my disease progressed to renal failure, and I was placed on hemodialysis initially. I needed both of my native kidneys removed. I needed a bilateral nephrectomy, and that was in October of 2011. So from there, I spent 5 years on dialysis. Eventually, I moved over to PD, peritoneal dialysis, and I do my treatments myself at home every night for 10 hours. And I'd unhook in the morning and go to work or go to school. And then I received the call, the magical call in the middle of the night, as I knew it would come. I was out hanging out with some friends, and the call came through, and it was the transplant coordinator from Northwestern in the middle of the night in 2015, December 15th, and I was offered deceased donor kidney. Of course, I accepted it. I went down to Northwestern to receive the kidney transplant. It took very well the next day, but as I was recovering, unfortunately, I caught pneumonia, and I had some rejection, kind of just up and down issues. But after plasmapheresis, transfusions, et cetera, a whole host of medications, the kidney ultimately stabled. And then that's when I completed my memoir in 2016, and just decided to continue being an amazing advocate and giving back to other individuals that I feel like I left behind on dialysis, or people coming after me, just to raise awareness about kidney disease and how it affects everyone. It doesn't discriminate.
I wanted to ask you about, I wanted to point out, back when you were at Tuskegee University in Alabama, you worked on your feet quite a bit, right? As a waitress and a tour guide, so you were standing quite a bit. Is that a fair statement?
Yes.
And after you spoke to the doctor there, I forgot what you called him, good Dr. Bob or something.
Yeah, Bad News Bob. Dr.
Bad News Bob, that's it. You called your dad. Your dad is a nurse, and he insisted that you fly home.
Yep.
Correct. And that's when you ended up at
background knowledge. Yeah, he had a little background knowledge of the kidneys, and so he could tell just by the blood work and how increased the protein was in my urine. So he automatically knew something was wrong.
Okay, shout out to my friend Bobby Reed, who just checked in.
Hi.
And I understand then at Northwestern, that's where you got this information that you had FSGS, that you would need to be on dialysis. You would possibly have a kidney transplant, but it was also possible that the FSGS could come back and attack your kidney. Is that right?
Mm-hmm.
All right. And then I understand that they did a biopsy, the tests were run. That's how they determined the diagnosis of FSGS. Can you tell us a little bit about what a biopsy is?
Absolutely. So a biopsy is specifically a renal biopsy is it's a procedure in which the physician will go in with a needle. You'll hear a few clicks of the needle kind of grabbing a little bit of kidney tissue, and then that tissue is sent off to a lab in which it is then kind of what's the word I'm looking for? It is analyzed, right? Yep, it's analyzed under a microscope, and then they can make a diagnosis of what disease you may have, if you have some rejection. So you can receive a renal biopsy in many different stages of renal disease, not just in it can be pre-transplant, post-transplant, pre-diagnosis. So it's a very common procedure.
Okay. When the doctor was telling you all these things, and then the last thing that she said to you is that FSGS could come back and possibly harm your transplanted kidney. Can you describe your feelings about that? How did that make you feel?
Yeah. Oh, I felt defeated. I was so young and thinking I had my whole life ahead of me. Just thinking I just began college. No way this could be me. You know, they had been terribly mistaken. I mean, I was so headstrong and confident, and at 19, I just thought I had it all figured out. And to hear that, it took a while for it to kind of set in, and it was devastating. But it's ultimately, I accepted the diagnosis, and I began seeking care with a therapist because I had significant depression. I felt like I had been trying to go to school and trying to work, and unfortunately, it was inevitable that my kidneys would fail. So that was difficult to.
Okay, you were dealing with one other issue
Mm-hmm.
at that time, that the idea about losing fluid. You needed to have fluid removed, but every time that you had fluid removed, protein would spill in your blood, and that was
Right.
causing your FSGS to get worse. Can you talk to us about that?
Right.
How did that make you
Mm-hmm.
feel?
Oh, defeated, which is a common theme when you're dealing with a chronic illness. Ultimately, I would urinate and urinate and urinate, and you thinking maybe I can get some of the fluid off, but not really understanding, um, but not fully understanding the the chemistry behind it all, right? Like how the body works, the physiology behind it all, and the protein would continue to gather in my tissues. Losing protein, I meant the water would gather in my tissues since I no longer had protein in my blood, which is albumin, to move the fluid around, to move the water around. So it ultimately just gathers in your tissues.
Okay, I understand that um, eventually you had to go on dialysis. That was in-center hemodialysis. Is that correct originally?
Mm-hmm.
How long were you on in-center hemodialysis?
I was off and on in center hemodialysis around technically 4 years and 10 months. So
Oh,
five
that's
years,
technical.
but I I would come off of hemo and then try PD and then get back on hemo if I had, a peritoneal infection, but ultimately PD was um my modality of choice.
Okay. I understand that you tried to work again and go back to school, but you developed a kidney infection. Can you tell us a little bit about
Yeah.
what was going on
Mm-hmm.
there?
Yep. So, yep, I developed a kidney infection. It was excruciating. It felt like I thought someone broke in my house and shot me in the back. I mean, I know I'm dramatic, but this is the worst pain ever. It was definitely in my top three. Was a kidney infection. So I guess I had a urinary tract infection that traveled up the ureters and then to the kidneys, in which the kidneys became infected. Excuse me, I'm sorry. In which the kidneys became infected. I was then placed on antibiotics and steroids for about a week. And then ultimately the infection cleared up.
Okay. I understand, Leilah, that you had a mental breakdown before you
Mm-hmm.
were placed on dialysis. You don't have to talk to us about this if you don't want to, okay? But if you do, can you give us some idea of what happened there?
Yeah. So, as I was stating previously, I was working and going to school, and I just couldn't believe the direction my life was headed in. I didn't know what dialysis was. It was like I was worse off prior to dialysis with the amount of fluid that was swelling. I mean, the amount of fluid I was gaining, the swelling, inability to breathe, then feeling like I didn't have the words or the tools to say that I was overwhelmed. And that's when I had a mental breakdown. I think now, um, after going through therapy for about 13 years, I have those tools. I have the words now and to say I'm overwhelmed. Um, but then it's very common for individuals who are facing something as grim as dialysis or a kidney disease diagnosis to not know how to talk about it, who to turn to not even have the language, right? Um, it's very common to feel
Okay.
depressed and feel defeated.
Let's talk a little bit. You reached stage 4 of kidney disease at some point, and you were referred to the transplant center at Northwestern Memorial. Can you tell us what went on there, and specifically the meeting of February 11th, 2011? What was
Oh yeah.
happening?
Oh yeah. So at the transplant meeting, all of my friends and family came down to donate to get tested. So there you will, as a patient, you'll go into a separate kind of area in the hospital or on the transplant floor while your family's being evaluated, you're being evaluated. You'll do blood work and urine, and you'll meet with a few physicians, a few psychologists, sociologists to ensure that you're mentally um, prepared to handle what a transplant will require, to handle all of the post transplant treatment, the blood work, just mentally be prepared for it, for the surgery. It's a huge life change. And then my family, we're getting tested to see if anyone was a match or a donor. And you'll also sit through a few videos, a few lectures or seminars from transplant nephrologists, nurses, etc., who will walk you through what the transplant process will look like.
Okay. And as I understand it, you were placed on hemodialysis. You had a catheter, a subclavian heart catheter. Can you explain what that is?
Oh yeah, the subclavian catheter. So I still have probably a couple of remarks here in which they will insert a tube into the heart underneath the subclavian. That's why it's called a subclavian catheter. Into the heart, and that will allow dialysis to kind of process through this catheter where the blood will go right into the heart, then through the machine. I mean, the catheter will come out of your skin. So once it's been inserted through the heart, it kind of comes back up and on top of the skin, and it will cycle through the machine and then come back up. um, the machine will then clean the blood, then return it through another side of the catheter.
Okay. Approximately when did you start on hemodialysis?
Oh, that was in 2011.
Okay. And do you remember where you were taking hemodialysis?
I think initially I started inpatient at Northwestern, and then maybe I transferred to a local clinic near my house. Near my house, typically you will transfer to local clinics in your area if they're if you decide to do outpatient hemodialysis.
Okay. And this is 3 times a week. And how long were your dialysis sessions?
Yes, my sessions were, I believe, 4 hours. Yep, 3 times a week.
Okay. Somewhere along the line, you mentioned that your kidneys were both removed, that you had a binephrectomy. Can you
Bilateral
tell us
nephrectomy.
a little bit? Okay, come on, Jim. Do your job. Tell us a little bit about what led up to the removal of your kidneys.
Okay, so as I was being placed on dialysis, my kidneys were still trying to work, right? They were still trying to filter out blood and urine, and ultimately I was spilling so much protein. My kidneys was just letting all of the protein, all of the albumin go, that the doctors decided it was best to remove them, and also to reduce the chance of FSGS coming back. Because although you can maintain your native kidneys post transplant, it's possible that having them, there may still be some disease within the non-functioning native kidneys, although they shrivel up to like the size of prunes. I think my doctors just decided it was best that I have them removed.
Okay. And this removal was done by laparoscopic surgery, is that correct?
Yeah. Yep. So I had my native kidneys removed laparoscopically, which is very similar to the transplant surgery. So it isn't as invasive as someone cutting you open and then having to go in and pull out the kidneys and then stitch them back up, then stitch you back up, or staple you back up. As I mentioned in my book, the less someone has to put their hands in you, the better. So just to reduce any kind of issues. So yeah, it was, and also infections, right? That's the biggest one. A
Okay.
minimally invasive procedure reduces infection.
All right. When and where did this surgery take place? When they
It
removed your
took place at
kidney?
Northwestern
Okay.
Hospital. The same. I stayed at Northwestern from the time of diagnosis to transplant, post transplant. That's where I go. I'm still receiving care there for transplant. Typically, you have to stay at the transplant clinic in which you were transplanted post transplant. But pre transplant, I think you can kind of go anywhere and get on the list.
Okay. I understand after the surgery you developed pneumonia. Can you tell us a little bit about that?
Oh yeah, post trans. You said post transplant or post nephrectomy?
I thought it was post nephrectomy. Did I get that wrong?
Oh yeah. Post nephrectomy. I mean, I've had pneumonia so many times. I'm actually one of the lucky ones to overcome it as many times as I've had. I probably have had pneumonia 4 to 5 times. So yeah, just if you aren't getting up and moving around post surgery, if you aren't using I can't say it, spirometer. Oh, I said it. um, that they give you to take home. If you are using that, you just lay around in bed due to the pain, you will certainly develop pneumonia. So that's how I caught it, but I overcame it again and again.
Okay. Wow. I didn't realize so many times. Um,
hmm
did you go back on hemodialysis at this point after the laparoscopic
I
surgery,
did.
after the pneumonia?
I did. I did go back on hemo. And that
Did you
was
have,
and that for me was like that was it. It was finite. It was the reality that um excuse me, the reality that I was forever dialysis dependent kind of set in and kind of hit me pretty hard post nephrectomy. There was no going back. There was no fixing the kidneys, even if a cure came out because mine were gone. There was nothing I could have done to save them, and I just had to face my life on dialysis until I received the transplant.
okay. Were there any issues or complications when you went back on hemodialysis?
Um, I did have seizures on hemodialysis. I had quite a few seizures. I What else? And the one thing that did not happen to me was that I did not have an infection in my subclavian catheter. And I kept my catheters off and on for 5 years, and everyone warned against it. They tell me not to keep a subclavian catheter. I've had maybe 6 of them, and I just didn't get them wet. I'd shower and I'd tape them up with a plastic bag. And for me, that was just kind of how I kept my normalcy, as opposed to getting a fistula. I mean, if anyone wants to get a fistula, I say go for it. You have to choose the modality that's best for you. You have to choose, everything. Any decisions you make regarding your body, you have to do what's best for you. No one can tell you what's the ideal way to live your life. Ultimately, you have to be your own advocate. So for me, um, I just didn't want the fistula. The fistula for me felt so permanent. And in my mind, I was so young. I'm like, I'm going to get off this and go back to living my life as if this never happened. And it just, it's just something that I was adamantly against, although a lot of doctors and nurses tried to convince me to get it. I think for me, not only it being permanent, but the idea that if they merged the two veins to make a super vein, that it was possible that the veins wouldn't. I mean, it wasn't guaranteed to work, right? Like you could get the fistula and it not work, and then you can't unmerge the veins once they're merged. So for me to keep my normalcy, I just got the chest catheters and never got them wet, and was extremely careful. I'd use alcohol, betadine, bandages, everything I could to just keep them extremely clean.
Okay.
But other than that, on hemo, I'd say I had a couple of seizures, and then I began PD. And ultimately, I just didn't enjoy going into the center after a while. After about a year, I was so independent and determined that um, I just felt better with doing it at home myself than to trust someone else to hook me up and do my dialysis for me. I just
All
I
right.
enjoy doing it myself. hmm
Okay. I know at this point in time you had been on dialysis. They removed both of your kidneys. You had had these issues while you were on hemodialysis. You were comparing your life to your peers at that point in time. Can you tell us how you felt?
Oh yeah. Oh, I watched all my friends move on, get married, finish college, purchase homes, etc. And I felt so left behind. And that's the worst thing you can do, is ever compare yourself to someone else, because everyone has their own journey to walk. the grass isn't always greener on the other side. You may look at someone else's life and assume that their life is better than yours, and they may be looking at your life and thinking your life is better than theirs. And I think sometimes it sticks with me in knowing or feeling like um, my friends kind of moved on with their lives, but I gained new friends and an amazing community in my kidney patient friends. And I think once you find your community and you find your people, that's what's most important. Not about who is, who's doing what, who's accomplishing whatever. I think once you kind of find your tribe, that's what life is about.
Okay. You mentioned earlier that you had started regular therapy. Can you explain why you started therapy and how it's been beneficial?
Excuse me. Yeah. So during my mental breakdown, before starting hemo, I did attempt suicide. I attempted to swallow 40 Tylenol 3 pills, and that landed me on the psychiatric floor at Christ Hospital. And then I was transferred downtown to Northwestern Hospital. And it was there that a lot of the doctors and nurses, they just validated how I felt. And sometimes that's all you need is someone to say, it's okay to not be okay. It's okay to be hurt. It's okay to cry. It's okay to be angry about what you're going through. And, my doctor just kind of told me, like, you have a chronic illness, you'll have peaks and valleys for the rest of your life. And you just have to learn how to manage until you get to the next peak. When you're in those valleys, you have to learn coping skills, and that's what they taught me. Like, I listen to music a lot. I like to create, just whatever. I like to scrapbook, make vision boards. As long as I'm creating, I'm happy. Um, I enjoy yoga. So just finding those games. I love games. Whether it's Xbox games, games on the cell phone, I don't care, whatever game it is. I'm super competitive, so I love games. Um, just I am very competitive. So
I got the feeling
whatever
I'm going to
it
get my ass kicked.
is, what you say, Jeff?
No.
What
Um,
you say?
let let's talk about your advocacy work for a minute. I know that you volunteered with the NKF of Illinois, the Gift of Hope, Donate Life of Illinois. Can you tell us about a little bit about your volunteer advocacy experience?
Yeah. Oh, I began volunteering. Ooh, when I was first diagnosed in 2008. I've been an advocate for well over 10 years. Kind of worked my way up from the bottom, from handing out flyers at the DMV around organ donation when it was called Donate Life, Illinois. And I was a volunteer with National Kidney Foundation. I go around to different community centers and educate individuals around kidney disease. Um, what else? It's just so much. Then I became a peer mentor with the National NKF, a patient editor of Kidney Living magazine. I've helped fundraise golfing events for NKF Illinois. And let's see, the Kidney Derby, NKF Illinois, with the associate board. And then I worked at the Gift of Hope, organ and tissue donation in the African American Task Force and community outreach. I've also worked with, well, how would I work with? I worked on the PFMDD, which is Patient Focused Medicines Development Project, in which I was sent to Brussels, Belgium to work on that project. What else? I've been a panelist with the FDA. I've been to Harvard, and all of this is just advocating for individuals with kidney disease. Many times it was just volunteer work because it's in my heart, it's my passion. I feel like I've been so blessed Um, and even when days when I didn't feel blessed, even before dialysis, it just was placed on my heart to always give back, always volunteer, always help try to move the ball forward. And I'm really blessed to say that I kind of reached the pinnacle of organ donation or like advocacy. Um, so then I left the space to finish my degree and work in a mental health space or help patients in a better capacity. I do plan to come back to advocacy, maybe sooner than later.
Well, we miss you. We need you back, man.
I know I'm coming back. I'm coming back. I miss you guys. I need you guys. Honestly, I'm like, where's my tribe? Oh yeah, that's right. My tribe is the kidney disease community.
Talk to us about home dialysis. I understand that you do. When did you start a home dialysis?
I started home dialysis. Let's see, my first year in on hemodialysis, or yeah, so around January, excuse me, 2012. So I was trained at the local dialysis center in PD, in which it only takes about a week to learn. You'll have all your supplies shipped to your home. Very simple, easy process. You have the catheter placed in your peritoneum lining. You'll hook up to a machine every night, and your treatment starts essentially right before you go to bed. You have the autonomy to change your treatments, to if I'm not changing your treatments, but choose your treatment time. So I typically start around like 8 or 9 p.m. before getting to bed, and then 10 hours. And by the time you wake up, 7 o'clock, the treatment's done. It could be a little painful, as there is some cramping, but ultimately you don't hook in the morning. You may have a midday exchange where you would go in midday and or you may have to hook yourself up midday for like an hour, have a couple of dwells, and the dwell is when the solution sits in your peritoneum, and that's essentially how the dialysis takes place. You will your peritoneum lining will kind of attract the toxins from your blood, attract the fluids through a process called osmosis and diffusion. And then as that kind of builds up in your peritoneum, you will then release it into bags. And that's kind of how you would urinate, but essentially it uses your own peritoneum lining instead of using a filter like the dialysis machine. And it's a little easier on the body. You aren't dealing with blood, you're just simply dealing with um, a sugar-based solution that you're just exchanging in and out, in and out.
Okay. You mentioned before when we were talking that you've had many occasions where you had seizures and problems. I want to talk about one particular occasion where you had a seizure, you had brain swelling, you ended up in intensive care, they
Yeah.
induced a coma. Can you tell us a little bit about what happened there?
Yep. So I I was hooked up to the only thing I remember was hooking up to my dialysis machine, my PD machine. And as I hooked up to my PD machine, I went to bed, and next thing I know, I woke up in the ICU 3 days later. So, what I believe, from what I was told, my mother found me having a seizure, and the paramedics were convinced that I wasn't going to live. They were so unsure. They worked on me in the back of the ambulance, took me to ICU, and then I was placed in a medically induced coma. I had swelling on my brain. I'd vomited into my lungs. And then from there, after I vomited into my lungs, I needed surgery to remove like a mucus plug from my lungs. I woke up 3 days later, and the doctors asked me, "Do you know where you are?" And I said, "Yeah, I'm in a hospital." I mean, it wasn't unusual for me to wake up in a hospital. So I woke up in the hospital, and yeah, I was in shock, like in complete shock. But I knew that I'd met God. I knew in the coma, I remember kind of like God just telling me it wasn't my time yet and that I needed to live. And yeah, from there,
Okay.
I uh, I recovered. I began to walk again and eat again and finish my life on hemodialysis. And then a year later is when I was transplanted.
Okay. I understand that you have experienced being put on hold for a transplant. Can you tell the folks what that is like to be put on hold?
Right. So you'll need to make sure that all of your blood work is complete, all of your um, exams, diagnostic exams, such as, let's see, what else? Let's say I need to do a stress test. You have to undergo like CT scans, X-rays, um, gynecological exams for women. What else? I mean, they will test essentially every part of your body and to ensure that you are prepared for transplant. But if any of those tests aren't completed or if any of your blood levels aren't stable, then they will place you on hold. So until you can get your level stable and also until you can make sure all your tests are completed, then you'll be removed from hold. And which isn't hard to do. It's devastating to be placed on hold because you feel like you aren't accumulating time on the list, and you also it's just I mean, any day that you aren't accumulating time on the list is difficult, and any setback while waiting on dialysis is difficult. So the sooner you can get off hold, the better. Whatever it is that you need to complete, whatever it is that you need to do, um, you have to do it. You have to make those exams. You have to eat well. You have to work out. You have to drink plenty of water. You have to take your medication because the state will pull your prescription records from the local pharmacy. They receive your blood work, so they know if you are not taking your medications, such as um, your phosphate binders, everything that you need to take to keep your creatinine as low as possible, to keep your vitamin D, your phosphorus, all of your levels essentially need to be as good as possible, right? As good as a transplant patient, potential transplant patient um, levels can look for a transplant. And that's one thing that I didn't learn until later on. I didn't know that they look at all of those records before they decide to transplant you.
Okay. One of the recurring themes that I have read about you is that you're a person that takes control over her life and takes
Yeah.
responsibility for what goes on. Can you talk to us about what you mean when you say that you should take control over your life?
Oh, absolutely. You have to be your own advocate. You have to be assertive. You can't just trust that um, doctors and nurses will that they and see. I don't want this to come off wrong, but you can't trust that they will always know 100% what's best for you. Only you know what's best for you. And they see thousands of patients at very little time. The medical system is overloaded, and the squeaky wheel gets the grease. And I was the squeaky wheel. I called and called and called my transplant center so much they were tired of hearing from me. I bugged and bugged my nephrologist. I bugged and called everyone I could. I got all the information. I dug around on the internet. I looked at scientific journals. I did the research. I learned everything I could possibly learn about kidney disease, about transplant, about what to expect, about medications, about exercise, about yoga, about meditation, about manifesting a transplant. I did everything possible. And anytime I felt like I didn't want to take a medication or I had questions about it, I asked. I always asked. Anytime um, anytime that I mean, from being in the hospital and a nurse giving me medication, I asked, what are you giving me and how much are you giving me? And I've caught mistakes. You have to be your own advocate. It's nothing. I mean, your life is in your hands. I'm so grateful for all the healthcare providers. I'm so grateful for all my doctors, nurses, etc. But they will tell you, like, no, Leilah did this herself. She did it all. You know, she took on her PD. We aided her. We were there for whatever she needed. But this was Leilah's doing. So I just want other people to know, right, that you bug your doctor in the middle of the night if you have to. You get his cell phone number. I had my doctor's personal cell phone numbers. And I was calling and calling, like I had nothing else to do. I mean, what else do you have to do but fight, right? Fight for your life. You're in the fight of your life. So, yeah. So just feeling like, I want everyone to be their best advocate, to be their advocate. And that's in all areas of your life. That's the best thing you can do for yourself, is to not ask the questions. That's it, right? To not ask the questions, about medications. If you don't know what hemoglobin is, ask the doctor to explain it to you. If you don't know what creatinine is, look online, get the information from somewhere. You need to know what the numbers are supposed to look like. You need to know if you're in the range, if you're out of the range, and what does that mean for you? How can you fix it? What can you do? You have to take it all on yourself. And you have to win. There's no other way around it.
Talk to me about December of 2015 when you finally did receive the call. What was that conversation like?
Okay, so a transplant advisor from Northwestern called, like a nurse, and she said, "Hey, Leilah, you're up next on the list. We have a potential donor, and the donor, unfortunately, he hung himself in prison. It's a DCD kidney." And I said, "Oh my God, not a DCD kidney! This is donor after cardiac death kidney." And those kidneys, they suffer some blood loss at posthumous. So after the person passes away. So typically, what happens is the heart has stopped, or the person's, like I said, my donor hung himself before someone could find him. So once they did get the kidney, they harvested part of the kidney, had lost some blood, but it was still pretty viable. Then from there, I packed my bag and I just told them I want it. Legally, you have to tell them if you want it, like yes or no. And I told them, yes, I'll take it. I'll take my chances. At that point, I looked in the mirror every day and I knew I was dying. So I had no choice but to take it. Like, there was I don't care what kind of kidney it was. I said, I'll just take my chances. And I believe you have 30 days after a kidney fail, or like from the time that a kidney may fail. And that you can be placed back on the list if the kidney fails from transplant. So I rush to Northwestern. I get there. They're asking me, like, what side do you want the kidney placed on? They're asking me, They're asking me, you know, are you sure you want it? It's taking a hit. It's coming from the gift of hope. It's coming down, um, it's coming downtown to you. We're going to operate on the kidney. So they operated on the kidney. And once they operated on the kidney, I went back into surgery. They told me I made urine on the table. The kidney took, and it was amazing. And some people they receive the call. I know people who've had the call 3, 4, 5 times, and they give the kidney to someone else because there are other individuals at the local transplant centers who are also waiting on the kidney. Depends on who's the best match for the kidney. Depends on who wants it, who turns it down. And I was blessed to receive mine on the first call, even though it was a little special. My kidney was special, but I was so grateful that I got it on the first call because I can't imagine receiving multiple calls and being heartbroken and devastated when you don't receive it.
Okay. I understand the date of your transplant was December 15th, 2015. Talk to us after you received the kidney. What was it like? I have a note about a blood transfusion. What happened after the transplant?
Right. So, we thought I was going into rejection. We thought FSGS was coming back, but ultimately I was just on the wrong combination of medications. I was on Prograf and I was on Prograf and Cellcept, I believe. And ultimately, I ended up on mycophenolate and cyclosporin. But Prograf, I reject on Prograf. So Prograf isn't a good combination for me. And that's what it was. It was just a matter of titrating the medications. The transfusion I needed was because my platelet levels were dropping. So my hemoglobin was dropping. I was becoming anemic. And then I also received plasmapheresis just to kind of remove any antibodies, washing the antibodies out of my system.
Okay. Let's talk about your health since the transplant. You're what, about 7 years out now?
7 years transplanted. Yep, it's been an amazing blessing. It's been a blessing. It is it can be tiresome sometimes still having to manage the transplant. You still have to do everything you did prior to getting the transplant, maybe to not the extent of dialysis, et cetera, et cetera. But you still have to ask the questions. You still have to be your own advocate. You still have to call the insurance companies. You still have to make sure your prescriptions are ordered and they're in. You just you have to take care of yourself. You have to drink plenty of water. And now you can drink a lot of water. And that's what's best to keep your kidney hydrated. Eat well. I mean, you can kind of eat whatever you want, but I try to eat pretty healthy. I was a pescatarian for a little while, but then then I'm starting to add meat back into my diet. But ultimately, you still, I mean, it's been the greatest blessing. I really feel like a living, breathing, walking miracle, like every day. So even when days get tough, I still remember what I went through to get here, how amazing and how blessed I am to be here. And yeah, it's been an amazing journey.
Okay. Let's talk a little bit about the book. Get it in the picture. I'm curious that the title, The Gift of Disappointment. Can you explain what that means?
Yes. Well, throughout the most difficult moments of my life, the most disappointing moments of my life, I received the gift of self compassion, wisdom, hope, uh, compassion for others, empathy. I learned so much about myself, about life, about the world, and just it was a gift. I don't know who I would be today had I not gone through what I've gone through. It's some usually in those valleys, in the most difficult moments of your life, is when you find who you really are, and that's how the title came about.
Okay. You mentioned that you had gone on a lecture series with
Hmm.
your book, and one of the places that you went to lecture was Harvard University. Can
Hmm.
you tell us what it's like to stand up in front of a bunch of Harvard guys and talk about your book?
I know. um, Extremely inspiring, and I think that's what inspired me to go back to school and pursue my doctorate. Right? It's like I'm just as good as these guys. You know, if I can sit at the table um, with the top researchers and doctors across the world, right? Like I I could return to Harvard with my doctorate. It was more so inspiring for me and encouraging for me to be there.
Okay. Um, Talk to us a little bit about LS Empowerment LLC. What goes on with that?
Yeah, so I continue to speak at the local college, Chamberlain College of Nursing, and I continue to market my book, and I sell books on Amazon and online, and most recently I've been featured on a let's see, there's a company called SPR Therapeutics Inc. So I've been featured there um, on their website, video, and I recently was a panelist. And SPR is a medical device company, and my shoulder was recently injured in a car accident. Tried out this new device that provides electrical stimulation to the nerve. Um, so it kind of reconditions the nerve pathway, the pain pathway that goes to the brain. It's a newer, kind of a newer, it's not a new concept, but it is a newer modality for pain relief. So most recently, I've been working with this company, and I'm just excited to see what the future holds for my business. I have an opportunity to work on a movie regarding my story. I most recently had a meeting with the producers of Transformers. Um, who else? Someone from the Discovery Channel. Who else showed up? The writer of Nope was supposed to show up. The writer of Rick and Morty. So I don't know. It's just been really, really amazing. Um, I know, yeah. So it's like every time I feel like I'm taking a break, there is no break. There aren't any breaks, right? When you're walking in your purpose and you're inspiring individuals, someone's gonna come across your story and they'll latch on and they'll pick it up, and people are just constantly always inspired by my journey, and I don't know, I'm just enjoying life and enjoying whatever comes next. I don't always plan
Okay.
these things out. They just happen.
Well, I want to tell the folks that if you want to drill down a little bit more on what's going on with Leilah, if you look in the comments to the original broadcast, I put several links in there for you, including the links to where you can go to buy the book. This is, like I said, this is honest to God my second copy. That's how much I liked it. So
Thank you so much, Jim. And you also helped me edit the book. You read the first manuscript, remember?
that's true.
That's true,
That's
yeah.
true.
Because you
But
are a former instructor, right?
right. You're the author though. Your Uncle Jim, he's a blogger. He writes down stuff, sends it out. He doesn't even bother to edit it. So that that's
Well,
where
I hired someone to edit the book, actually. I didn't. I didn't edit all of it myself. That's what editors are for.
Right, right. Okay, we're in the home stretch here, Leilah. Do
Okay,
you have
awesome. It's
any
been fun.
statement that you would like to make before we conclude the broadcast tonight? Is there anything
Yes.
you'd like to say to our audience?
I always like to say disappointment isn't to your detriment, but to your advantage. You can learn self compassion, wisdom, empathy for yourself and others. The most difficult moments in your life will take you very, very far. And hang in there, be your greatest advocate. And there's nothing more important than being your greatest advocate. Only you can do that. And as Jim says, I like to take control over my life.
All right. Well, Leilah, I'm going to let you go then. I have some small stuff to do to close up with our audience, but I just
It's
wanted to
been
say
fun.
what a great talk, and I miss our
Oh,
conversations, and I'm so happy that you were able to make it tonight and
yeah.
teach us
Thanks
and
for having
educate
me.
us on kidney disease and what's going on.
Always. Let's talk soon. I should probably get back into some advocacy work with AAKP since I'm in Springfield and it's nothing really going on down here. I miss you guys. I'm so used to being busy.
Yeah, yeah. Well, we'd love to have you back, and
Okay.
if
I am
you
gonna reach out
keep
to
us posted
Aaron
on what's
Kale.
going on in the future with all those
I
movies,
will.
and I think you should
I
write another
know.
book. That's just my
I
opinion.
know. Everyone wants a second book. We'll see.
All right.
I can eke out
Take,
another book. Okay.
take care, my
See you
friend. You have
soon.
a good evening.
You as well. Bye bye.
We'll talk soon. Okay. Well, folks, that's our broadcast for this evening, and thank you to Leilah. She was great. And wow, what a lot of information we covered tonight. So I'm going to sign off, and I have a broadcast that I recorded with June Monroe. I'm going to be out of town next week. However, I'll be back on Friday. I think I'm going to go ahead and publish that broadcast and play it on next Saturday evening, which I think is the 25th of March at my normal time, and we will see you then. So, thank you so much for watching, and we will talk to you very soon.